Another condition that we see that's very, very common is called rotator cuff impingement. And what happens is the shoulder, as a person reaches up over their head, they'll get a pinching sensation that actually travels down the side of their arm. And then usually when they're coming back down, go ahead, you drop back down, it'll feel even worse because the tendon that actually lifts the arm is compromised up in here, but it's deep, deep into the joint. So what you want to do is, instead of just treating the one joint, you want to be able to treat the entire shoulder girdle, which includes your shoulder blade in the back, the structures in the front, into the anterior and posterior parts of your neck. And assessing posture is really important for that, because if someone sits slouched, kind of slouch forward, and then you go to reach, that's going to cause more of a pinch than if you teach someone how to sit up taller and how to use the muscles that are back behind in their shoulder blade in order to make room, so when they do reach, everything's working together in order to make that smooth movement where you're going up and down. And people don't know that. They'll just keep reaching overhead, and not ever figure out how weak they are in the back of their arm, and it causes that impingement and eventually leads to a rotator cuff tear, that actually is a very painful and very hard to rehab type of surgery. So we'd like to avoid that as much as possible by assessing the shoulder as a whole.